much easier because of the conceptual clarification that he has made. I'll be talking about medical ethics from an Islamic perspective. My thinking is that our talking about ethics is because we are dissatisfied with the medical ethics as presented in the Western concepts. The concepts that the Westerners have today arose out of a reaction to a lot of ethical violations. But in the process, they did not develop them in a comprehensive view. And I think in Islam we've got the paradigms that can enable us to develop a comprehensive view of ethics. Also, these ethical issues arose and the solutions couldn't be found in the positive law. So I have a feeling that ethics is a discipline that has grown in the West because there were moral problems that the law couldn't solve. Why? Because the law was secularized. It doesn't have morals, it doesn't have ethics. So we have to create a different field to deal with those problems. We as Muslims, we never separated our law, positive law, from morality. Morality is embedded within the Sharia. That's why I even doubt whether we should ever use the word ethics, because Sharia involves ethics. Morality is embedded in the Sharia. Now, as I said, the modern medical ethics in the West arose as a reaction to ethical violations. And in the Second World War, the Germans and the Japanese carried out a lot of unethical things in medicine. So as a result, a Nuremberg Declaration was promulgated as a code of medical ethics, the Helsinki Declaration later on, in the US, the Belmont Report of 1979, and many other international documents. But this always had a problem. One is that these ethical principles arose as pragmatic reactions to ethical problems with no consistent underlying theory. So you find a lot of contradictions. The second thing is that none of these documents stopped ethical violations. And I'll be giving you examples. Up to today, we have a lot of violations in medicine continuing. Now, in the Second World War, the Nazis carried out very cruel experiments. They could put people in a very cold tank of water to see how long it takes a person to die. Because their pilots would be shot down over the North Sea. They want to see how long should they continue looking for the downed pilots. The Japanese carried out terrible things in China. They could dissect prisoners alive to study how the body works. They don't kill him, they dissect him alive. They used to expose people to very freezing temperatures. They used to test grenades on humans. How big should a grenade be to kill somebody? So those were violations in the Second World War. Now, in the US itself, in 1966, there is a report about children being given injections just to test how the hepatitis virus infects people and how does it develop. Injecting cancer cells into debilitated patients without antibiotics to see if this disease is not treated, how does it progress? And this is very recent. The worst of all in the US between 1932 and 1972, they got 400 black Americans in Tuskegee with the syphilis. And they kept them without treatment. Although penicillin was known, but they wanted to see how does syphilis develop if you do not treat it. In Japan, 1951, they wanted to see how does the brain deal with the sugar in schizophrenic patients. So they just cut out, open and cut out part of the brain and test it. Of course, the people died. In China, recently, in the 1980s, they carried out a study on how folic acid and neuro problems occur. They denied, they stopped women from taking folic acid. Although we know already that folic acid is useful, but because they wanted to see what happens if you do not take it, they carried out this study in China. In India, they injected cancer cells, 1999 to 2000, very recent, cancer cells into patients to see how. So in Africa and Thailand, Latin America, there are many violations that are occurring. Even right now, there are many violations that are occurring. The point is, all of these ethical declarations have not stopped the violations. And me, I think because they are not part of the law. In an Islamic environment, these ethics would have been part of the law, and enforcement maybe would have been stronger. So there's the Nuremberg Code, Helsinki Declaration, Belmont Report. The details I will leave the PowerPoint here, you can read. Or they have very good principles, but actually they are not carried out. Beneficence, we should do things for the benefit of patients, but in reality it's not done. Justice, it's not done. Many people were left untreated for the purposes of understanding medicine. Now, we come to the big issue that modern medicine and modern ethics from the European perspective, I feel they don't have a very consistent theory and very consistent principles. I will start by discussing what are the theories and principles as used or stated today in a Western environment. Then I will discuss the Islamic theories and Islamic principles, which I think we should follow and are much better. Actually, whenever I give talks about this, even in a Western context, I've never found a challenge when I present the Islamic ones. They said, it makes more sense. Huh? Yeah, one Australian came to Malaysia to teach us ethics. I spoke. Then he asked them, why did you invite me? If you have got this one. So, yeah. So, there are certain theories, and there are about 8 of them. I'll go through them very quickly. Utilitarianism means that we judge things by the consequence. Which means, well, if the outcome is good, somehow we could use methods that are not so perfect. The obligation-based theory of Immanuel Kant assumes that a human being can reason out right and wrong. But as we know, Quran says, وَمَا كُنَّا مُعَذِّبِينَ حَتَّى نَبْعَثَ رَسُولًا, that we will never punish people until we send them a message. The human mind can work out right and wrong, but sometimes gets confused. So we cannot rely on the human mind too much in everything in determining what's ethical. The other theory is rights-based. They say people have got rights. What is ethical is respect their rights. Somebody wants to kill himself, let him kill himself. Somebody tells the doctor to kill him, let him kill him. Somebody wants to abort, let them abort. It's their right. So as long as we respect people's rights, it's ethical. There is another theory which is community-based, which says that it's the democracy. What the majority of the community feel is ethical, is right, is right. That is why 100 years ago, if you're homosexual, you would be either imprisoned or classified as crazy and they take you to a lunatic asylum. Today, if you talk about homosexuals, you go to prison because you're being homophobic, you're violating their rights. So, because the community has changed, and this is a community-based theory. Then there is the relations-based theory. This one, we say in the hospital, do for your patient what they want. Just keep good relations. No issue of halal and haram, right and wrong. Just good relations between the doctor and the patient. That's what's ethics. And then there's the case-based, which means we be pragmatic. Now, so those are the theories. As you can see, they are not a consistent theory. They don't have the same source. Some are from philosophers, some are from the Greek ideas, they are not consistent, and whenever we use them to solve problems, we do not find a robust solutions because there is no underlying philosophy that puts them all together. There are also some European principles that we use in ethics. This can be stated as one principle. Some people say utilitarianism is enough to solve all problems. Some others use the Hippocratic principle, which says, take care of the patient, don't worry what happens to others. And then the libertarian approach, just giving the patient the right to decide. So they say you only need one principle to solve all problems. There are other formulations that have got two principles, like beneficence, doing good, and non-maleficence, do not do harm. They say those two are enough. Then there is another formulation, which is the Belmont Report. This was commissioned by the US Congress, and it came up with the three principles. Respect for persons, autonomy. It means you need to get the permission of the patient in whatever you do. Beneficence, bring good to them, and justice. And there is a 4 principles formulation since 1976. Autonomy, it means respect the patient's decision. What they decide is ethical, as long as it's their decision. Non-maleficence, don't do harm. Beneficence, do good. And justice, fair distribution, fair treatment. So those are 4 principle formulation. Now, there are a lot of critiques of these. I don't want to go into them. Those who want to read can look at the PowerPoint. But what I want to say is that these 4 principles all fit into only one of the Islamic principles that I will be talking about later. And in clinical practice, we do not find them useful. So doctors cannot solve problems using these principles. Apparently, the ones who made them were not practicing physicians. That's what Prof. Tarek say, is that the people with the knowledge, ilmul waqa, should be involved, because these principles, doctors do not internalize them very well. They are external to them. Okay, now let us go on to talk about Islamic bioethics. I've been teaching this approach in East Asia for the past 15 years, and we have graduated many students, and we have got this work in many medical schools in Indonesia, in Malaysia, here in Brunei, and it is working very well. It seems to be natural, understandable, and very usable. Now, there are certain characteristics. First of all, the divine source, that our ethics, by the way, I use the word ethics, but I shouldn't use it. Really, but there is no other Islamic word. I should say Sharia, but we use this word, we have no choice in order to be able to understand one another. The ethics have got a divine source. Then law and morality, there's a big difference. In the European context, legal is not always the same as moral. In the Sharia, whatever is legal is also moral, and vice versa. What is immoral is illegal, is haram. But in the Western concept, it's not consistent, and one can give many examples. There's no consistency about legal and morality. Just a simple example. Adultery, in today's Western law, if you cheat on your wife, you don't go to prison. It's immoral, but it's not illegal. In Islam, no. It's immoral and it's illegal. So this makes a very big difference in the approaches of the law. The other issue is that Islamic law is very comprehensive, and it's a combination of moral and positive laws, whereas the European law tries to deny the moral aspect, because moral brings in religion. But again, because he knows that there are things that cannot be solved by positive law, he has to develop this new discipline of ethics. And it's a new discipline. When I went to medical school 30 years ago, we did not study ethics. Yeah, it's only now that it's coming up. Because medicine has produced so many problems for which there is no solution in the law. So you need a new approach, and that's why we are having this field of ethics. Now, ethics can change. There are certain fixed parameters, but within these, with ijtihad, ethical judgments can change. And the moral justification, we can use deduction, which is very much Hanafi, starting with the theory and applying it on a practical issue. Or we can use induction and qiyas. You know, we can use several cases, issues, and develop a theory. Now, so in our approach, I want to say that there are some overriding principles or paradigms. Tawheed provides the integrative framework that whatever we do in Islam fits with everything else. Shumuliyya, the comprehensiveness, as Prof. Tariq said, this is a word that we abuse a lot. It's a slogan, but very few people really approach it in a serious way. Tawazun, we need to have balance in whatever we do. And then tadafa, we need to know that there is action, reaction in whatever we do. So these are overriding principles. We don't have time. I cannot explain in detail how they relate to ethics. So, and I also think that we have got an ethics theory. The Maqasid Sharia, I think, is our theory of ethics. That whatever we do should fulfill one or more of these maqasid, or should not violate one or several of them. حفظ الدين, حفظ النفس, حفظ النسل, حفظ العقل, and حفظ المال. So these principles, stated very succinctly by Abu Ishaq al-Shatibi in his book Al-Muwafaqat fi Usul al-Sharia, really were developed since a long time ago. It all started with Imam al-Haramain al-Juwayni and his student Abu Hamid al-Ghazali, Ibn Qayyim al-Jawziyya, and his teacher Shaykh al-Islam Muhammad bin Taymiyyah. Abu Ishaq al-Shatibi came towards the end and formulated them very well. And these maqasid al-Sharia, the purposes of the Sharia, are derived by induction from the Quran and Sunnah. So this is the theory of ethics. Whatever you do, check with the 5 maqasid. And then we also have got qawaid al-fiqh. The maqasid al-Sharia as the basic theory, in practice you may run into problems. Like I said, حفظ النفس, protection of life, and حفظ المال, protection of wealth. If somebody is in ICU for 1 year, it's taking a lot of money. Should we pull the machine or not? حفظ النفس says keep him there. But we are wasting resources. Also, there is somebody who has been brought in an accident, emergency, who could make use of that bed, and you are keeping somebody there who is nearly dead. So the purpose of life and the purpose of resources seem to be in contradiction here. This is apparent contradiction, but to solve these contradictions, we can use qawaid al-fiqh, the principles of the fiqh, and I think this should be called the principles of ethics. They are the 5 main ones, al-kulliyat al-khamsa, the principle of intention, and the principle of certainty, principle of injury, principle of hardship, and principle of custom. Principle of intention says whatever you do, we judge by the intention inside, not what you say or what's written. Like, for example, doctors, there could be a 90-year-old man with cancer all over his body, crying with pain. The doctor says inject morphine in him to decrease the pain. But the doctor also knows that at that age, morphine causes respiratory depression. So he may say, inject, let him rest. He knows the man is going to die. But legally you cannot take him to court because he's giving him a drug that controls pain. So we say we need to, al-umur maqasidha, we need to judge by the intention. Second, certainty, this is evidence-based. Should we pull the tube or not? We need yaqeen. is the person alive? We have got tests to test that somebody's brainstem is still alive. If still alive, we cannot pull the plug. Principle of injury, قاعدة الضرر, really this one is very powerful. It involves judging benefit and harm in whatever we do in medicine, and it includes all the four Western principles. First of all, autonomy, the Western concept of autonomy, that it's the patient who must decide and not the doctor. It is because it is the patient who has his interests best at heart. Nobody will harm himself. If we let the doctor decide, sometimes the doctor may have a dinner appointment, and there is a woman in labor. Now 5 hours, 6 hours, she's not delivering, and the time is coming. So doctor says cesarean section, because cesarean section can be done very quickly. Last time I used to do it in 15 minutes, 20, we finish. So you do it, deliver and go to your dinner appointment. Yeah. So the doctor may be biased, but the patient can never be. That is why we put the decision making in the hands of the patient. You explain to the patient the advantages, disadvantages, alternatives, and they make the decision. So autonomy is to prevent injury. قاعدة الضرر. Beneficence and non-maleficence is the same. It has to do with benefit and injuries, and also justice. So the four European principles fit only in one of the Islamic ones. Then there is the principle of hardship, قاعدة المشقة, which says الضرورات تبيح المحظورات. Whenever we're in a difficulty, what is haram becomes halal for medical reasons. Normally, a man shouldn't see the aura of a woman, strange woman. But to save life, this is allowed. And the last one is custom, qaidatul aada, that what is ethical is what is generally accepted by everybody in the profession. So you as a doctor, you do not imagine a new operation out of your mind and you do it. You need to follow what is accepted as general custom in the profession. So here I described in detail what each of these maqasid Sharia means and how it applies to medicine. Those interested can read the slides. Yeah, really an application of this from a medical context. Also, I explained the maqasid Sharia with examples in medicine. قاعدة القصد, قاعدة اليقين, قاعدة الضرر. This is the most important one. Really, the application. I do not want to take your time explaining the details. Those interested can get the PowerPoint. Again, قاعدة المشقة. This one legalizes doing things that are normally haram because of saving life. So then قاعدة القصد, العادة, custom, which requires following standards. So let me summarize. I said that the European ethics basically arose as a knee-jerk reaction to violations that occurred. But because of its genesis, it did not start with a good theory that makes it very consistent. So there are many theories, I mentioned 8 of them that we use. In practice, we have a lot of trouble applying them. Also, there are principles, sometimes 1 principle formulation, 2, 3, or 4. Again, we have some problems dealing with them, but basically, those 4 fit only under 1 Islamic principle. Then, I presented the Islamic alternative. I said that the theory of maqasid Sharia is the theory of Islamic ethics. That whatever we do should fulfill or not violate those maqasid. Then I said that we also have got principles of ethics. These are going into detail to deal with areas that the maqasid are too broad, because the qawa'id can go into details. By the way, I told you 5 qawa'id al-fiqh. These are called al-kulliyat al-khamsa. These are the 5 main. But each one of these has got many other principles that we can take out of it. In the area of business, the Majallat al-Ahkam al-Adliya, they have done this. They took the 5 basic Qawa'id al-Sharia and they also added on up to 99. The ulama already had developed the Qawa'id until about 99. From these 5, the 99 you can fit each one of them into one of the 5 al-Kulliyat al-Khamsa. But then the Majallat al-Ahkam al-Adliya by the Ottomans went ahead to develop up to 1,600, 700 principles in the area of business and commercial transactions. I think the challenge is for us to have a similar majalla in each discipline. Maybe we need one in medicine, we need one in other areas. The advantage of using principles is the following, that the law as written from parliaments, the type of legislation that we get from the West, is very detailed and very specific. So when it comes to a judge, sometimes a judge may make a decision that in his mind is not right. But because the law constrains him, it says if somebody commits this, this and this, convict him and give him 5 years imprisonment. It is for that reason that Muslims have resisted canonizing the law, the Sharia. The ulama have resisted writing the Sharia as articles of the law that we normally see, because it creates an inflexibility that can lead to injustice. But also, leaving the Sharia very open makes it very difficult to apply, and it gives the judge too much leeway of interpreting things as they like. Stating these Qawa'id principles is much better because the principles are precise, but then they don't go into too many details, so that when a specific case comes about, we have a general principle, but then we can use our judgment in order not to commit injustice. I did prepare a few cases. I have 4 minutes. Practical cases. I just want to test you if you understood me. Yes. I have about 11 cases. Could someone pick one, any number? Case number what you want to discuss?
This one is fine.
Number
Case
1?
That's
Okay. So this is a 60-year-old comatose accident victim with injuries to many organs. He has got a card, he signed, he's Singaporean, that he was willing to donate his organs. Now he's in a very remote hospital, and the doctor examined and found that clinical signs of brain death were positive. But 2, you know, we've got about 10 or so, all of them are positive, but 2 is not sure about them. He's some doubt. But the family says, doctor, declare death, because he has a cousin who needs the kidney. So the sooner we declare it, because you know when you wait too long, the kidney deteriorates. Basically, you have to take it out of a living person. So doctor, please, this man is gone. You know, he's 60 and all the organs, and the cousin needs the kidney. So what will you do if you are the doctor?
operate.
Get the kidney. Yes.
اليقين لا يزال بالشك.
أيوة.
Yeah, yes.
There's the issue of yaqeen.
Yes.
Because the clinical signs are not all there. So the doctor doesn't have the yaqeen that the man is dead. But this man is going to die. Really, he's going to die. So there is another Sharia principle which says al-mushrif al-halak kal-halik, that if you are going to die, you are treated like somebody dead. Can we apply this here?
I don't think, because at least we got, you know, maybe 2%.
What about maqsad hifz al-nafs? There is that cousin. He's going to be served by this kidney. Shouldn't we use that to, you know, override the issue about yaqeen? Doctor is not so sure, but you know.
We have to advise doctor just to take this the best advantage for the living person.
The living, we kill the
the man.
Yes.
Taking out kidney won't make people die.
Yeah.
Yes.
Taking out one kidney doesn't make people die.
Yes.
Do what?
Taking out just one kidney doesn't make people die.
Yeah. We can survive with one kidney. Take one, leave one.
Okay. Yes. Yeah.
What about your knee as a doctor?
Yes, because that also Qa'idat al-Qasd comes in. Because the doctor, he really wants to save the cousin.
Yeah.
You and me know this man is going to die.
Yeah.
He's all, you know, it's a matter of time. So the doctor could say, he doesn't tell them that, you know, I'm not sure about 2 signs. He will say, okay, he's dead. Nobody will ever find this out. That is why we tell him, we Qa'idat al-Qasd, that al-umur maqasidah, we are going to judge you by your inner intentions. Because what we do, when we are doubtful somebody is dead, we shine a torch in the eyes and see if the people react. We put pressure here and see if the eyes move. We put very cold water in the eardrum, and see if the eyes are moving. We touch and see if he, you know, there's specific tests. So if I do 10 tests, 9 are positive. 2, I'm not so sure, you know, because I look, I'm not sure did the eye move or not, you know. Not sure. I can say, okay, Allah, can sign that is dead, and we take the organ. Yeah. Yes.
The ends may be good, but the means not necessarily.
Yes, that is part of the Qa'idat al-Qasd. That in Islam, al-wasa'il laha hukum al-maqasid. You know, in Islam, the end never justifies the means. It's part of the Qa'idat al-Qasd. As I said, these 5 kulliyat have got many others that lie under it. So, doctors in hospitals find using these principles very easy to reason things out, to make quick decisions and to make very robust decisions. And I think if we can inculcate this, alhamdulillah, in East Asia, a lot of our medical students were already teaching them this. In the future, inshallah, this should make medical ethics much easier. I think it's time. Otherwise, I had more cases to discuss. Yeah, my time is finished. It's now your time.
We would now like to invite the next moderator, Associate Professor Mulyadi Kartandagara, to supplement and share his insights into Professor Kasule's address, to be followed with a question and answer session.
Answer the question. Assalamu alaikum wa rahmatullahi wa barakatuh. It seems that we have only 15 minutes to go, so I don't want to waste our time, precious time, and I let you to raise some questions, but please be short. Yes, so in order for others to have also chance to ask to this very excellent presentation, very interesting actually. Please. Okay.
After all the assignment?
Please tell the name and the origin.
Yes. Assalamu alaikum. My name is Omar Kasule from Malaysia. I just want to try and bring the two sessions together. Just now, Professor Kasule was mentioning that he feels that the term Sharia actually connotes ethics. But the first presenter, first keynote, the stress was on understanding Quranic concepts correctly in order to build, the conceptual frameworks important that need to be implemented. My problem with the statement of Professor Kasule is that, unfortunately, the term Sharia is not correctly understood. And coming from an economics background, if you look and see what's happening in Islamic banking and finance, all these banks have Sharia advisory boards. But they understand Sharia to be legal, to be the law. And so when you look at the way Islamic banking finance is developed, it's with regard to the law. And even if you say maqasid al-Sharia, and you want to use this novel or the high objectives of Sharia, but if you still understand the Sharia to be law, you still may not get the right vision, to use the term in the first. And so my point, I think, is how do you convey this correct meaning of the Sharia? If you say it includes all of this, but that's not there at the moment. It is very narrowly understood and practiced, which is not to the advantage of the Ummah, as we can see from maybe the practice of Islamic banking and finance.
Yeah, Jazakallah kulla khair. Really, I think we need to go back to the original meaning of Sharia. Brief history. The word Sharia at the beginning meant law, fiqh, and aqidah. Then aqidah was removed, it became only the fiqh, comprehensive fiqh. Then after some time, people removed public affairs from the Sharia. Sharia became ibadat, munakahat, and actually became ibadat and marriage and inheritance. Then after some time, even it became narrower. In many of our countries, Sharia now means only marriage and burial. And even this narrow area, people are trying now to narrow it down. So really, the word has lost its original meaning. The original meaning, we should go back to the comprehensiveness, and it includes both law and ethics.